Today we're unboxing Charmin Ultra Soft Smooth Tear. Wow, these wavy edges tear so much better than ordinary.
Yeah, the lights are really bright. Okay, all right. I said that on the microphone. All right, good morning. We know that there's probably people that are going to be streaming in as the session goes on, but we want to get started out of respect for everyone's time and interest in being here. I'm Renee Wizig-Barrios. I am the president and CEO of the Jewish Federation of Greater Houston, and I've had the privilege and responsibility of co-chairing the Mental Health Working Group with Steve Greenbaum from Chicago, and we've been working since last summer as part of the Rebuild Israel process. And I'm joined by some really amazing panelists and colleagues who I will introduce in just a moment. But I did want to share just at the start, unfortunately, there was some tragic news from Israel this morning. There was a terrorist attack at the Gush Etzion junction. There was one fatality and one person who is seriously injured. We don't have their names yet, so hold them in your thoughts and prayers today. I think we all know that the topic of mental health and trauma in Israel is one that we care deeply about and have been working hard on, which is why we're all here today. If you happen to work for an Israeli nonprofit that is working in the mental health space, will you please stand so that we can recognize you this morning? Thank you. We have so many amazing partners in the space, and we're excited that you're with us today. So we're at an inflection point. This is probably getting repetitive to keep saying this in every session, but I know from having just returned from a mission to Israel in October that things are a bit different now. With all of our living hostages returned and a ceasefire, while maybe sometimes feeling tenuous, it is still, a different phase than we've been in before, and the war is over-ish, in quotation marks. Experts have noted this could bring both positive and negative results. And it's really clear to us that regardless of what those results may be, we know that trauma is rippling through families and communities really all over the country, even for people who are far from the front lines. And there is support needed at multiple levels. Israel is a global leader in trauma response, but yet the scale and the complexity of the recent events have stretched all of the systems and revealed significant gaps. And emotional and psychological healing is a really long-term process. It's not, unfortunately, quick. So all too tragically, the numbers are clear and stark. Just as a reminder, 165,000 Israelis were internally displaced. Of the 300,000 reservists who have served the IDF, over 200,000 have families. And at this point, there are over 70,000 people recognized by Israel's National Insurance Institute as victims of terror. And there are over 6,000 bereaved families. So while these numbers are staggering, and we have been told to expect that around 1 million individuals will need some kind of mental health support, we also know that this is going to include a variety of interventions, and you're going to hear more about that today. It's not only one-on-one clinical support and counseling, but community resilience and support. So we have an amazing group of speakers to help us understand the state of affairs and the opportunities that we have. Rena Goldberg is our Vice President for Israel and Overseas at the Jewish Federations of North America. She deserves all of those kudos. Based out of Israel, she leads the team there responsible for allocation strategy and implementation of the Central Fund of the Israel Emergency Campaign, which we all know reached over $900 million. So this is a behemoth effort that Rena has been leading. Jonathan Huppert is the Helen and Sam Bieber Chair of Clinical Psychology and professor in the Department of Psychology at the Hebrew University of Jerusalem. Yes, an amazing colleague as well. After October 7th, Professor Huppert founded the Center for Trauma Recovery. He has been working for over 25 years, treating, studying, and working to improve treatments for anxiety, obsessive-compulsive disorder, post-traumatic stress disorder, and other disorders. Gila Touloub is the co-founder and executive director of ECAR Collective, advancing trauma healing in Israel through collaboration across mental health, public health, and philanthropy. Gila brings extensive experience in strategy consulting, including 12 years at McKinsey & Company, where she co-led global work on vaccines, health equity, and mental health. Please welcome Gila. So the format that we are going to take today is we're going to have a dialogue and conversation, and we want you to be listening, and we want you to participate, writing down questions that you have on cards on your table, and then at the end we will make sure we get time to address those, and we have some JF&A team members who will collect them. So I want to start, Rena, with you. Talk to us a little bit about what the Federation has already achieved and how we have been focusing on supporting mental health up to this point.
Thanks so much, Renee, and good morning, everyone. It's great to be here with you. So to prepare for the session, I went back in time, actually to a time that was, for all of us, really challenging, especially so in the first few months after October 7th. It was a bit of a trip, right? When you look back at your notes, at your emails, at the meeting protocols, you see what we knew, what we thought we knew, and what we assumed. And it's a real gut check, right, to look at where we are today. So while we know now that federations have allocated $81 million to 168 unique NGOs, those early days, we couldn't have imagined the full scope of the need, nor what we could have accomplished until now. I'll just give you one stat. We're estimating, again, from organizations that have reported back to the Central Fund, more than 500,000 mental health touch points. So in some way, supporting someone in that continuum of care following October 7th. It's important to note that when we say mental health, that is a broad umbrella definition for everything that includes resilience, trauma relief, well-being, in addition to clinical diagnoses that some of my co-panelists have expertise in, and certainly those that were pre-existing or compounded by their experience on October 7th. Our immediate goal was to provide relief, leveraging existing and innovative capabilities. We prioritize immediate access to quality mental health services to those directly affected, survivors, evacuees, bereaved families, first responders. We also looked to be sure that we were meeting the needs of specific populations, whether it was offering services in multiple languages, culturally attuned practices, with practitioners or in environments that would be successful to the mental health support for each of those patients. This meant focusing on direct care and preventative treatment to ensure that those that were most affected received that sort of basic mental health care or were directed for further treatment as necessary. Now, we sort of think about our work at this stage in phases, but of course the phases were not linear, they overlapped, they were also aspects of the work that we started thinking about early on, but perhaps were not implemented until further. But after we sort of thought about direct care, we looked at community resilience. This stemmed from conversations that we had in late 2023, 2024. We collaborated with various stakeholders and partners to learn from one another. The enormity of the challenge required this sort of ongoing learning and engagement with all these different key partners. And with the key support of a pro bono international consulting firm, we dug into the subject matter, desiring to learn from experiences outside of Israel. What did FEMA know, or the State Department, or other models in different countries that we could adapt in Israel? And we viewed charts and timelines projecting the different phases of the response. I think we knew even then that the baseline for immediate relief to recovery to rebuilding was not going to quite apply in this situation. The prolonged nature of the trauma, the secondary trauma, the ongoing open wounds of the hostages, the wartime footing. So if optimistically it was thought that immediate relief was 3 months, and then 3 to 6 months for recovery, and then after that rebuilding, we knew that that wasn't going to be quite a fit for the emergency work. And I think even then, we started to build into our strategy this outlook, which is why we had 2 of our strategic pillars were medical and trauma relief, and the second was community resilience and rebuilding. We were using the word rebuilding starting in December 2023. And so now as we talk about rebuilding Israel, we can be proud of the ways that we planted those seeds even back then. So the second phase of the grant making was really focused on communities and resilience and community structures. So this could be a community like evacuated kibbutz or moshav. It also could be a group of people, so informal education for teens and youth at risk, summer camps, whether in Israel or abroad. We then started to look, again, to this recovery and long-term impact about system-level growth. This aligned with our desire to move beyond the original mental health capabilities of the Israeli system. Gila and Jonathan are going to say more about that. But this included training and capacity building to increase the number of trained professionals, to improve the quality of the care. Just because someone works in mental health, that doesn't mean they have the ability to apply the right treatment in the right sort of way. This was always the case, but certainly it was magnified after October 7th. It was also in this time frame that we made investments with JDC to the Mental Health and Wellbeing Initiative, their partnership with the Ministry of Health nationwide, hundreds of municipalities, a program that has created clear criterion for local authorities to select and promote public health and wellness programs for its citizens. And as well, this is the signature project of this third phase, the partnership with the Ministry of Health to establish a service that until now, or till the last year, did not really exist. Outpatient service for those suffering from severe trauma from within the community. The goal was to increase access to mental health services and locate the centers within the communities to decrease the stigma for those seeking help. The contribution of Jewish federations, and this is the central fund, together with the federations of Chicago, Toronto, Houston, and Dallas, enabled the establishment of 18 centers, 2 more than originally planned, focusing on different populations, age groups, therapeutic approaches, all the way from the north to the south of Israel, enabling reservists, civilians to cope with the severe trauma that they've experienced as a result of the war without the stigma of hospitalization or being within a hospital in some capacity. We could not have anticipated the need, I think, or the impact that these centers would have. And our partnership with the Ministry of Health has ensured that they have sort of the highest level look into the work plans, the therapeutic methods, ensuring that they're evidence-based. I know also that NGOs are carefully monitoring as well as they should to sort of check the assumptions that we all had in developing these programs. And I'll say that more than 5,000 people to date have received support in one of these centers. And again, it's the gamut of the special populations of October 7th, hostages and their families, victims of sexual assault, evacuees, Nova survivors, etc., and of all ages, children all the way up to adults. So that is just, I think, the tip of the mental health impact iceberg. Something that I hope that you all share the same pride that we have and the impact that federations have had thus far in setting the stage for the conversation we're having now around rebuilding Israel and what more we can do in this space.
Thank you, Rena, for sharing that. And it is important to realize that we have accomplished a lot in a very complicated and difficult time. So, Jonathan, talk to us a bit about the Center for Trauma Recovery. You have been a critical partner of the Federation's operating across a few different strategies. Can you share some highlights?
Sure. Thank you very much for inviting me to come. And we established the Center for Trauma Recovery after the 7th, but it was really a continuation of work that we had started to do even before the 7th. I, for the last almost 10 years, have been working with the Ministry of Health in terms of disseminating evidence-based treatments into the public health system. And we really saw that the 7th was an inflection point that allowed us to consider what we were doing at scale, much more than what we had done until then. So what we have done over the last 2 years is really, we have 3 main things that we've worked on, and we have 2 more that we're working on developing even more now. The first thing was, even before the 7th, we had been training clinicians in the Kupot, in the HMOs in Israel, and we had gotten feedback that they needed more trauma-focused training. And actually, we had set up to train first supervisors in October 2023, and then clinicians in May 2024 in a specific trauma-focused treatment. that is considered one of the standard of care throughout the world. After the 7th, we decided to train everybody immediately. And so we trained 150 clinicians in November 2023. And we took that as a launching point to then start to do other trainings as well to other clinicians throughout the public sector. And so we now have set up a whole training system, which is quite a bureaucracy. We've currently, including the current cohort, we've trained over 700 clinicians throughout the country in over 80 different clinics in one of 8 different approaches to trauma-based treatments. And when we say training, we have a very high standard of care. First of all the treatments that we're training people in are considered standard of care, evidence-based treatments according to international standards. And when we say training, we don't just provide a workshop. We don't believe that workshops are very effective in training by themselves. It has to be a workshop followed by at least 20 weeks of a small group supervision that we ensure that the people who are providing the supervision are also top-notch and experts in the approaches that they're supervising. And we do this for adults as well as for kids in terms of the treatments that we're providing. And we also ensure that there's measurement going on throughout the trainings that are being done, and that measurement on multiple levels. So patients are filling out questionnaires in order to give feedback to their clinicians. Clinicians are filling out questionnaires in order to give feedback to the supervisors. And supervisors are filling out questionnaires in order to give feedback to us. And we're able to look at all those levels simultaneously. So we do a lot of training in trauma and grief as well. And we also have developed an application, an app for PTSD based on, again, one of the most evidence-based treatments for PTSD. This is an app that's very unique. It hadn't existed in the field at all. There's a lot of apps that exist that suggest techniques here and there. This is the first app that I'm aware of that is really trying to help take an individual from A to Z through a whole process of treatment. And we developed it in a way that it can be used either in what's called blended care, so along with the treatment they're getting from their therapist, or as a supported care. That's the main way that we are hoping that it'll be used, meaning that the therapist will have the client or patient using the app as the main aspect of treatment, or for the 20 to 40% of people who never seek treatment, it could be also a standalone intervention. And so we've developed that along with a partner in the tech sphere, SQL Care, and we've already treated 3 patients in my lab, and now we have launched a trial at Sheba Hospital with the unit called Sheba Beyond, where we're going to be treating 130 people over the next 2 years with this app. The app also allows for electronic measurement, to be having patients fill out symptoms throughout their time, and that also is something that we're aiming to have that incorporated into the whole public health system as well. And we also have already gotten initial approval from the Army, from Afat, to be working on getting it integrated into the Army. Once this trial is done, and once we hope it shows that it's effective, then we'll be working on trying to get this also into the Army as well. And the third thing that we immediately said is that we need to, in order for this all to happen, there has to be greater awareness, both by clinicians and by the greater public, about what is the standard of care for treatment. First of all, what is post-traumatic stress disorder, and what are other responses to trauma? When do you seek treatment and when don't you? And if you seek treatment, what are the evidence-based treatments that exist? And in order to do that, we developed, first of all, a public campaign that's been launched now. We actually just had our 2nd episode of a podcast on on one of the major networks has their own podcast called Echad Bayom, or One a Day. And we have the first 2 episodes have come out already, and we have another 6 episodes that are all about trauma-focused treatments that are going to be launched over the next 2 months, basically. And that also includes a campaign that leads them to a website that people can self-check whether or not they're experiencing PTSD symptoms, and if so, how should they seek treatment if they are experiencing those symptoms. And we also, with the generosity of the federations and JFNA, we also are translating a self-help book into Hebrew and into Arabic. The Hebrew version has already undergone most of the translation and should be coming out in about 6 months. And that includes 5,000 hard copies and a free audiobook and a free digital copy. And the plan that we're doing with that is that physicians as well as therapists will be able to give a prescription type coupon of this book with a QR code, so they can either get an electronic copy, or it will be available in all of the Somet Sfarim books throughout stores throughout the country. And in terms of community interventions, that's actually the next level that we're working on starting to develop. And one of the things we're going to do is create book clubs to be using this book, to be discussing what's going on. And so those are all of some of the different things that we've been doing since the 7th and that we plan on continuing to do.
So amazing, and I'm sure people are thinking of a lot of questions. It's wonderful to be hearing capacity building, deepening expertise, but also innovation through apps, community level awareness, campaigns, so many different aspects. That leads really well, Gila, into the work that you've been doing as you've been trying to map and understand this field. So share with us what you have learned about the ecosystem of mental health since October 7th and how you would describe the current state of affairs.
Sure. So thank you for having me. Does it work? Yes. Yeah. So thanks for having me here, and thank you for the partnership over the last 2 years. I would start by saying this is really one of the largest mental health crises that we've seen in Israel, but also I would think, the impact, the scale of it is more than anyone has seen in terms of the collective nature of it, where everybody has been impacted. But if I can use an analogy, I would say that we entered the war with a system that was already wounded, right? We had a system that was already under-resourced, a system that was already fragmented, and a system that was already understaffed. And what this war has done is that it has increased the visibility on those issues that were already existing, but now are impossible to ignore. So a few points for you guys to take with you. Under-resourced, you could actually think about Israel is putting 5% of our total budget spent, health spent on mental health, right? 5%. And compare that to 7% in the US or 10 to 11% in European countries. And think about, what's happening in those countries where Israel is facing a little bit more trauma than those other countries. And fragmented, let me take you a bit further in history. Israel has universal healthcare, which we all know about, and it's a great system. And they also did something really smart compared to other countries with universal health system, is that they decided we're going to have 4 HMOs. So if you've been to Israel, you might have heard of Leumit and Maccabi and Clalit. And those 4 HMOs are behaving like for-profit insurance groups in the US, competing for healthy individuals, and competing for having great services and digital tools to attract the healthy individuals. So you have universal healthcare, but with this smart and healthy competition that makes them want to provide better care and services. But when that happens in 1994, when they created those 4 HMOs, mental health was not included in that. The government continued to be responsible for mental health. So what happens? You have 21 years until 2015, where mental health is neither here nor there, right? Government says it's soon going to be the HMO's problem, and the HMO says it's not my problem yet. So you have 21 years where the population almost doubles, and no investment in mental health resources. So what happens? A bunch of NGOs start to lead, because that's what happened in civil society. When there's a gap, people stand up and fill the gaps. And now what we've done at ICAR is we've mapped what are those NGOs, who are they, and what are they doing. And nobody knew because the Ministry of Welfare didn't know, Ministry of Health didn't know. And we thought maybe there's 200. I mean, you guys all feel it. You probably get a grant request, every day from a different NGO that's doing mental health. We identified 400. And when we looked at the numbers, we actually saw that half of their budget comes from the government. So they're really an extension of the government, but it's very fragmented, so the data is not shared, the learnings are not shared, your files are not coming with you, and we have this fragmented system. And then understaffed, Israel has 1,000 psychiatrists. That means we have doubled yet. Here we have 2,000 people attending this conference, right? So half of this would be the psychiatrist population in Israel. I always joke, like you can fit them into a conference very easily. They all know one another. Only 150 are specialized in children. 150, let that sink in. And we have 10,000 clinical psychologists. It's not a lot. And as Jonathan was explaining, most of them are not even trained in evidence-based PTSD and trauma techniques, even though we don't know exactly how many there are. And last year, 12 psychiatrists moved to the UK. Bristol understood they could steal some psychiatrists from Israel. And I remember it was in the news, and wow, 12 people are leaving. And, people are thinking, like, why are we making such a big deal of 12 people moving, But it's 12 out of 1,000, and it's those attending that were supposed to train the next generation. For Israel, it's a lot of people. And you asked me about the current state in Israel, but I do need to point out that the current state of mental health in the world is not great. And it's not like we have a playbook that we could say, oh, the UK is doing this amazingly well, the US is doing this amazingly well. During COVID, Israel was, put as this example of doing such a great job. But we had a playbook. The Bill and Melinda Gates Foundation has eradicated polio in Nigeria. So if they could do it there, we could do it in Israel and do it even better. Here, we don't have a playbook. There is no recipe of, oh, here, take this recipe and apply it. If there was, we would be really amazing, because Israel is great at execution.
Well, those are all very sobering facts, but we're not going to despair.
Nope.
We're continuing to dig in. So knowing that the systems are, not exactly what they want to be, let's talk about how Israelis are doing right now. So Gila, how do you see, despite the fragmentation and everything else, all of us who've been to Israel have our perspective, but how do you think Israelis are doing with this?
Yeah, so the short answer is Israel is a very resilient nation. And, I always joke, but you guys know they try to kill us, we survive, let's eat. Now there's actually science behind epigenetics, like we're kids, we're children of survivors, right? So we are a resilient nation. Having said that, we are also living through collective trauma. You mentioned the numbers of injured, displaced, but since October 7, 2,000 people have been killed. That's the number of attendees at this conference. And 1,000 children lost a parent. So in a small country, that means everybody knows somebody.
Right.
It hits really close to home. I don't think you'll meet anyone in Israel who doesn't know someone. And that creates this mass grief and mass, complex situation. Now, even we know now that those wounds, those emotional wounds, are spreading really fast. Clalit, which is the HMO that covers 50% of the population, has been analyzing the number of new diagnoses in PTSD. Since the beginning of the war, 100,000 people have been diagnosed, 100,000 new cases of PTSD. And when you look at the incidence rate, that means how many people get diagnosed every month, we're basically at 2x diagnosis compared to 2022, before the war, right? And that's not changing, that's steady. What does it mean? It means it's not like we're diagnosing people after an acute event, and
Right.
so, and now it's down because it's been 2 years, so people were diagnosed after October 7th. No, it's actually a lot of those cases are due to the chronic stress, and that's why we have a steady state of 2 times the number of diagnoses month to month. And so, you were saying, we expect about 1 million people to need mental health. We think, 500,000 will need actual PTSD, but we know that beyond PTSD, for every case of PTSD, 1.5 about will get also, mental health issues such as depression and anxiety. We also know that people are more likely to have any behavior that gives them a sense of control, right? Like eating disorders or addictions. 1 in 4 Israeli already recognize that they're using substances more than before. I'm not talking about illegal substances necessarily, right? Just, Clonex or Xanax so that you can go to sleep. And then in the morning, amphetamines so you can wake up. And it's not a moral failure. I just want to be really clear. Like, it's actually the way people cope after 2 years of chronic stress and trauma. So we shouldn't, point fingers or look at this as a moral failure. It's actually the resilience. And that's what I want to focus on as well. We see people getting up, volunteering, continuing to function, families that rebuild, classrooms that are open. We see, communities that have lost everything that are really, going back out there. So I think we're a country that's limping and that is, wounded, right. But we're a country that's standing up. And that's really the paradox of Israel in general, right? We're a resilient nation even though we're in pain.
And you see that for sure when you're there. Our community was there in October, and every point you're saying, I mean, small businesses that through our loan funds have continued to operate, and organizations like Israel Trauma Coalition and others that we've supported, where there has been at least also the adaptation too of taking care of those who are taking care of others, which was something I think in the early stages that wasn't being done, but that now appears to be doing better. So obviously, the system has been overstretched, but how do you feel like it's doing despite that in trying to respond to this massive situation?
Yeah, and you said it really, really well. Like, it's overstretched, but it's adapting. It's adapting really fast because it has to. And because, like I said, we don't have a playbook. So we need to adapt as we go. And to your point before, like, nobody knew 2 years ago what would work, what would be implemented. And so what we're seeing is, and you guys know Israel is a startup nation. Well, it's the same in the social entrepreneur field, right? So we have a lot of people, hospitals, NGOs, clinics, academia. Everybody is really mobilizing in a great way, but the issue is without coordination. And so what we're seeing is a lot of efforts that are not connected. And you feel it because you see all of the different organizations. But think about the population. The mental health professionals don't know where to refer people. And the population themselves, they don't know where to go. They don't know where to turn. And we see also that resources are concentrated in the north, in the center, not in the north and in the south and in the peripheries. So whenever you have situations of crisis like this, health inequities also grow because the access is not as good in peripheries, but also in different languages, or in culturally adapted care for the Haredim or for the Arab Israelis. And you mentioned the toll on the caregivers. That's a real concern. We talk a lot about our soldiers, but the front line from this emotional war are our mental health professionals. And so we know that the one-on-one is not going to be the solution. No country in the world would be able to give one-on-one care to its entire population. Huh? It has to be the solution. One-on-one? No.
All right. Well, we'll take questions in a moment. Thank you.
So I think we need to think about 2 parallel tracks. And it goes back to a bit what you were saying before. There's one track where we need treatment and care for all of the people that are deeply impacted today. Experts think it's between 12 and 20%, let's say, of the population that will need that type of care. And then we need a track that takes care of those 80 to 85% of the population that is still getting up every day and functioning, right. But we need to keep it that way. And so we need to do what's called secondary prevention, resilience building, whatever it's called. And those 2 tracks need to happen in parallel, which means that we need to invest more in the system. And which means that we need philanthropy to partner with the government in sustainable ways. And now I think we talked about the fact that Israel is resilient, and I think we need to now test the fact that our system needs to be as resilient as our people, so that we can create a sustainable system that can take care of people both on the treatment side and on the prevention side.
Thank you. Jonathan, what would you add about what you're seeing in the field today that we haven't heard?
I would just say that I do think there are models that we can learn from other places in the world. In England in particular, there's an excellent model that used to be called the Increasing Access to Psychological Treatments. Now it's called Talking Therapies, where currently they treat over 1 million people a year in a stepped care model. And the stepped care model says that let's give people according to what their needs are. We can start with low-intensity treatments like guided self-help and unguided self-help. And then for people who are not responding to that, we can step up to individual or group treatments. And then if that's not working, then we can step up into more intensive individual treatments. And what I would add to that is that I think there's probably a level below even guided self-help, which is community interventions. And community interventions are ways to help not only build resilience, but also deal with low-level symptoms as well. So it's possible that everybody needs some kind of one-on-one, but not all of that one-on-one has to be from a mental health service provider. And so there are different levels, and anyone who's going to be involved does need to know what their limits are so that they know when to identify this is beyond me and I need to step up. And so in order to do that, we need really to have integrated care so that there are systemic ways of looking at this whole process.
That's very helpful. And I think all of us, we have the compassionate inclination that everyone needs something one-on-one. It's a matter of what they need and what the right approach is.
I like what I would say is actually, we talk a lot about the UK, the US, Australia. That model of friendship benches was invented in Zimbabwe.
Oh, wow.
There was a psychiatrist who came back from from the US, where he trained, to Zimbabwe. He said there are 4 psychiatrists in the whole country. So I'm never going to be able to help everyone. So he created these friendship benches where peer-to-peer support is the rule of the game. We train elderly women in general in active listening, and they start that support with folks one-on-one on those benches in the middle of the community.
Oh. So there's a lot we can learn from other places. That's a great segue into, I think, the last part, which is probably what people are most interested in, which is really where philanthropy can play a role. What can we do, and what interventions should we be supporting to address some of these challenges? And one of the things we've talked a lot about in the working group is the situation is ever changing. So we all want to do evidence-based work. We want to know that there's data undergirding the choices that we're making, and that's complicated in this situation. So talk a little bit, Jonathan, about where you see promise and opportunity, and also where are you getting the data to say that these are good things to invest in?
So I think it's really important that on the one hand, there are already standards of care that exist. We don't have to reinvent the wheel. And almost all of the international and national guidelines throughout the world have very similar recommendations. There are here and there little differences. But so the first thing is really checking, are the places that you are supporting really trying to use the standard of care? And I think one piece that is often missing is that standard of care also means standard of care in assessing outcomes, and really encouraging and even demanding that anyone who you're supporting is getting feedback, is getting some kind of outcomes from the work that they're doing. And then I think the other piece that's really important related to the fragmentation is, and how does this integrate into the whole system that exists already? In order to not create more piecemeal types of things that are not filling holes that are necessary, and instead are filling holes that there are other people who are already trying to fill those holes. So I think those are probably 2 of the most important things to make sure. And I personally think there's a lot of necessary innovation on the one hand, but I would distinguish between innovation and experimentation.
That's an interesting distinction. How would you distinguish that?
And I think that there's a lot of new techniques that people say are, can replace standards of care. And there's a quote that extraordinary statements require extraordinary evidence, right? And so before you start to try to replace the standards of care, you want to make sure that you're meeting the standards of care. And so innovation means how do we adapt those standards of care to make sure that they're meeting the needs of the population, but not how are we completely creating new things, which oftentimes are reinventing the wheel. So there's not necessarily such innovation within some of those new things anyway. But to try to understand by consulting with experts, both in the US and throughout the world, as well as in Israel, to be sure that what's happening is a reasonable standard of care with innovations and adaptations that are necessary for each population.
Okay, great. And Gila, where do you see opportunity?
All right. So I mentioned earlier that I think we need, treatment, prevention, and there's a layer of enablement, like enablers and tools. So I'm going to give an example of in each of those. So on the treatment side, I think we need, the very specialized services. For example, on eating disorders or addiction and suicide prevention. Those are 3 behavioral health issues that are very much linked to trauma. And our hospitals are full. Israel has 92% occupancy rates in psychiatric hospitals, the most in the world. Also because we don't have long-term care facilities. So elderly individuals with dementia are very often just put in the psychiatric hospitals and using beds that could be used by other people. So that's one thing we need to think about, how to rebalance this. And one of the things that we're speaking about with people is how do we create, there's a concept in Israel called batim meaznim, which is like a halfway house or residential system. We don't have any that will be willing to accept someone with suicide ideation. And today we really need that because they don't always get a bed in the hospital. And so and the hospital is not always the right thing for them anyways. So how do we give them a solution? So that's one on the treatment side. On the prevention side, we looked at also psychoeducation that Jonathan spoke about. Jonathan talked a lot about psychoeducation of the people that need the help and evidence-based treatment. We want to also do psychoeducation for the 80% of the population that is doing well, and we want them to continue to be well. We want to normalize some of the things that they're feeling. Tell them your brain is not broken because you can't sleep. It's actually doing its job, right? It's trying to protect you. It's hypervigilant because of what we went through, and that's okay. It will get better. So we're launching a big psychoeducation campaign that will be on TV, on social media, with experts explaining this, and that's also an opportunity for everyone to get involved. It's going to be the first campaign that actually brings together all the different ministries and the large organization, and I see in the room we have Federation of Philadelphia and Chicago and the GFNA who's supporting this, so really we're very grateful for that. And the third thing I would say is on the enablement side. I mentioned how hard it is to navigate the field. I think philanthropy has a great opportunity today to help build those tools that will match the patient with the right service and programs based on, it doesn't even have to be super smart at the beginning. It could be filter based, are you married, do you have kids, and does the service also take care of those family members? And then over time, it could become smarter and smarter.
Yeah, I've told everyone that during our Hurricane Harvey experience in Houston, developing those tools that did the right matching for services really proved to be important. And so that navigation piece we often don't think a lot about, but when people are under distress, the easier we can make them to find the right match so that they have a successful experience is so important. Yeah. So Rena, from your perspective, where are our big opportunities?
Well, I've recently, and some of you may be familiar with the phrase, I just learned it, and the concept of a wicked problem. A wicked problem is a complex issue with incomplete, contradictory, and constantly changing requirements, making it difficult or impossible to solve with a single definitive solution. Attempts to address one aspect of a wicked problem often reveal or create new challenges. And solutions are judged as better or worse rather than true or false regarding ongoing adaptation and collaboration among stakeholders. When I read this, I both breathed a sigh of relief, I felt seen, and I was also a little bit terrified. Because I think what you've heard today from Jonathan and Gila and Renee's experiences, both as the co-chair of the working group as well as her time spent in Israel and the Federation's deep work in this space as well, is that it's incredibly complicated. And there's a lot of moving pieces, and it's very hard to identify those solutions, especially when we're talking about human lives and the most fragile aspects, in some ways, of human lives. So I will say, and this is my pitch, and I think Renee's going to make one too, for the working group that's focusing on mental health. All Federation professionals and lay leaders are invited to attend, and you can find me afterwards or after the GA, and we can make sure you're hooked up into that group. Has helped make a little bit of order to hear the questions that are coming from you, the Federation lay and professional leaders, sharing your experiences and insights, to gain insights from experts who are have all the knowledge and are positioned to be able to share what they're learning from their disparate parts of the field. And notably, I think to acknowledge, and this is where the relief comes in, is that there's no silver bullet. Instead, there are many options for federations to continue to have an impact in the work. And that's the part I really want to emphasize. There are so many ways that we can continue to do more, and at the level that's appropriate for your federations, for your donors, that is really tailored in that sense. So I want to share 4 insights or opportunities that have come up from the working groups, and one update that I'm really proud of and that I think shows an example of what we're going to see in the coming months and years. So at our first session, Danny Brom, who's an expert in PTSD from the organization Métis, some of you may know him, while he applauded all of the emergency mental first aid that was given, made it clear, and as we've heard here as well, that we really need to focus on evidence-based interventions. At our second session, Shlomo Mendelevich, who is the director of one of the psychiatric hospitals, works with Clalit, that Gila mentioned, an expert again in PTSD, emphasized the importance of strengthening Israel's public health system, which is the backbone of our healthcare in Israel. As an Israeli, I can attest to that. Our third session, Alison Nyman, who's the CEO for Mindful Philanthropy. This is an NGO here in the States that works with philanthropists who specifically want to invest in the mental health space, offered 5 obstacles to giving in mental health, and I'm not going to say them all, but only say that it acknowledges that funders often feel that their funding is wholly insufficient to make a dent in the problem compared to the immense need. Again, I think we all feel that, and I think we know that our work also does make a difference, and so you should all feel proud of it. And finally, at our 4th and most recent session, we heard from the Federation in Houston and the Federation in Greater Metro West about their different strategic interventions that were intimately connected with the work of those federations, aligned with the way they work, their partnerships, again, highlighting the unique opportunities that every federation has to contribute. The last thing I want to share is that sometimes things take time to do them right and to develop. So starting in about February, we started a conversation with the Shashua Family Foundation, which is a large family foundation in Israel, about a program that they were developing to support the recovery and rehabilitation of hostages and their families, including the wider circles, not just the immediate members, but out to second, third circles. As of today, and again, we started this conversation in February, the program is coming together. In a few weeks, the first pilot, which included specially trained social workers supporting 40 families, are working to develop long-term plans, looking for ways to fill the gaps between what government services they do receive, needs they have that are outside those services, on both the family level, the individual level, the social level, economic and employment, so that these approximately 160 families, representing 4,000 Israelis, the Israelis who have been in our hearts, in our prayers, for more than 2 years and will continue to be, even as the live ones are home with us, and we pray for the return of the remaining 3, who have experienced the worst, will have a path forward to a new life. And I'm proud to say that Jewish Federations, as part of your commitment and your support of the Israel Emergency Fund, is partnering with the Shashua Family Foundation on this amazing initiative. But it took almost a year to get to the point where it was really ready to move. And some of these projects that are going to be developing are going to take a long time, but when in the end, they're going to be so worth it and will have the impact that all of us desire.
Thank you so much for sharing that. So now we want to hear from you. What we're doing is you have cards at your table. If you have a question, Susie, who is here in the front, and Shayna, where's I don't know where Shayna is. If not, Jessica, if you can help. If there's cards to be collected, if we can move around the room, we're going to bring the cards up. And while we're doing that, just to reiterate some of what was said, look, at the end of the day, every federation has to assess where you want to spend your time. You always have the option of giving to the overall JF&A emergency fund and saying, I would like to support mental health initiatives, but I want the experts in the field who are spending the time studying it to deploy it on my behalf. So one option is give to the Rebuild Israel Fund, say you want it to go to mental health. Another option is to pick a piece of this puzzle, whether it is psychoeducation, and if that seems like something you don't understand, it's educating the population, right, about how to identify signs of distress and how to reach resources. If you want to focus on training and capacity building of professionals, that is another very important intervention. If you want to focus particularly on hostage families, you could continue to support the kind of initiative that Rena has brought out. If you want to focus more on innovation, there are those opportunities. So those would be 4 big areas that I think we've all heard about that we could lift up as different pieces of this puzzle that we're going to continue to need to support.
Renee, while Susie is looking at the questions, we had discussed beforehand a particular topic that we thought the group might be interested in hearing. Terms, do you want to?
Yeah, so I know all of us, every time we read a story about a suicide of a reservist or a Nova survivor or someone else, we feel this unbelievable sense of despair. So Jonathan, talk to us a little bit about how suicide, prevention and treatment is happening in Israel right now.
Sure. It's a very sensitive and difficult topic, of course, on many levels. And one of the first things that I would say that's really important to understand is there's a difference between a public health message and how we're dealing with suicidality versus an individual level on how one should deal with suicidality. And too large messages to the broader public risk contagion and risk actually exacerbating the situation versus it getting better. While one-on-one, whether it be with a clinician or whether it be with people who have been trained or at least taught how to discuss these things, can actually reduce suicidality. For example, there's a myth that asking people about suicide can induce suicidality. We know that that's not the case, that it actually reduces suicidality to ask one-on-one. But on the other hand, when stories become glorifications of suicide in the media, that can really put contagion and circles of risk to be increased. We fortunately do have experts in Israel who are really experts in suicide and suicide prevention and have developed programs in schools and outside of the schools. I'm in touch with also individuals in the Army who have been working on this. The Army actually initiated years ago one of the most successful suicide prevention programs in the world, which was having people who were in basic training not take their weapons home.
So the U.S. Army hated that thing of taking guns away, so they said, no, not a good program.
And it reduced suicides tremendously when they did that. Obviously, right now, there's a whole shift in terms of people with their weapons, and that may have to get reevaluated again at some point soon. But so it is being addressed on multiple levels in the Ministry of Health and in the Ministry of Defense and in other places as well. And people are trying to use the state of the art in order to try to do it as much as possible.
Okay. Well, thank you for sharing that. So some of the questions that came from the group, as we talked about, who is treating the therapists? Is there anything that is being done to protect and support the ones who are providing intense therapy? So who wants to answer that question?
We could both.
Yeah, I'm happy. Go for it.
I'll say that one of the things that we find, so as I noted, we've trained over 700 therapists in the public sector, and the small groups of support that we provide and the support we provide to the supervisors has people have said repeatedly that it's really important. Some of it is just acknowledging the pain of hearing these stories repeatedly and encouraging people to know when they have to not take on more patients or limit their caseloads and to engage in self-care, right? We know that 3 of the most important things for every individual is exercise, eating right, and sleep. And even just making sure that everybody is, the therapists as well, are engaging in self-care and getting their own therapy when necessary as well.
Yeah, I mean, you guys have all heard the put on your oxygen mask first, and that's the message that everyone is trying to get out in the field. The ITC, who does, colleagues are over there, who do a lot of training, also, have programs for supervision and taking care. Teva, who has an ESG program, also is prioritizing taking care of the therapist. And there's a new organization called Mashiva Ruach, chimes, wind chimes in English, something like that. Winds of change. I don't know. They are specialized in this, and they give actually training on all of those self-care tools, and they go to the different organizations as well. I
just want to say that we were Jewish Federation's the Central Fund. Provided them capacity building support from the very beginning, renewed support of them. They've been doing excellent work, and again, a moment of pride for federations about this important area of focus.
Great. So another important question is, how are you prioritizing who gets treatment first? And as a subset, where do the IDF soldiers fit into this whole picture in relationship between the Ministry of Defense and the other parts of the public health system?
All right. So so ICAR, we like to think about it as a population health level. So we know that there are at-risk groups, right? Like the people from the Gaza envelope, the people who are at Nova, etc. But at the same time, we know that some people who are not in the front might also be at risk, and so you need to, help people where they're at. And so the question you're asking about the soldier is really a complicated one. In Israel, when you're a soldier for those 3 years of mandatory service, you are no longer part of any of the HMOs, and you're completely covered by the Ministry of Defense. And during that time, you could actually think about it as veteran affairs, right, where everything goes through the Ministry of Defense. But as soon as you're done, you go back to being part of the HMOs. And by the way, the HMOs get no data from those 3 years. So those 3 years are just gone from your medical record. Whatever happened during those 3 years, you could choose to decide, you could choose to share that with your provider, but also it could get lost. And so when you're a reservist, you're already back into your HMO, and then you go serve in the Army. And so at that point, you could get some service from the Ministry of Defense, but also through your HMOs. And that's where there's a lot of complicated factors, because then you need to prove whether any of your issue is combat related and Army related or not. Like if someone says, well, actually, you had this thing happen to you in childhood, and so we don't think your problem is linked to the Army, then the Army will say, like Ministry of Defense will say, HMOs need to take care of that. So it's a very complicated place to navigate from a soldier perspective, right? They always have to think, okay, is it Army, not Army? Is it HMO or Defense? And also for funders, they need to understand what organization gets funding from the Ministry of Defense or Ministry of Health to take care of soldiers, right? So sometimes you have an organization that comes to GFNA to ask for funding, but actually for half of their soldiers, they're getting funding from the government, at least for the one-on-one therapies. For the soldiers who don't have a full diagnosis, but that can't sleep at night, can't hold the job, but they're subclinical from a medical perspective, they don't get any reimbursement. That's where philanthropy comes in. Or for anything that's group therapy, or nature-based horseback riding, no funding as well. So all of this, like the flow of money is something we are always like trying to map out for people who are interested in understanding like where money comes from and where it goes, because it's complex.
Yeah. Can I just add one thing on that before you? So when I was recently in Israel, I got to go see one of these community health centers that we've supported in Akko, the Mazur center. I'm trying to make sure I got the name right. And what they were describing is that they are doing this innovative group PTSD treatment for soldiers who have the most severe needs. They've done one round, they're going to do a second, and they were describing just that the funding for the professionals is coming from the government. The funding for many of the innovative therapies, which are making a difference, it was really fascinating. Art therapy was the thing the soldiers most wanted. They had given them a choice of sailing therapy and art therapy and other things, and art therapy was actually, from the first group, the thing people most wanted, and those therapies were being provided by the philanthropic support of all of our federations. So while it is this confusing web, I think a lot of what we're trying to do is, where does philanthropy either need to fill the gap that the government is not funding, be the accelerator to push the system forward in the ways we need it, and or leverage the resources that are needed for areas that are not going to be funded publicly.
So I just want to add to all that the system in Israel is complicated on another level, which is that people can seek private treatment as well as public. Everything that we do, we are trying to encourage the public sector to be covering as much as possible. At the same time, for personal reasons, oftentimes, people have preference for private treatment as opposed to going through the public sector. They're for privacy reasons as well as for just personal preference reasons. It's about half-half in terms of mental health services are provided by private therapists versus the public sector. I really hope that the more that we're able to improve the public sector, we'll be able to get to 75 to 80% as opposed to half. But for sure, there are people who fall through the cracks. So many people from lower socioeconomic classes do not seek private treatments and are stuck in long waiting lines in the public health system. And at the same time, for example, for soldiers, soldiers who have not seen combat but have PTSD fall between the cracks. And there are a lot of them currently from having watched videotapes of the massacre and having to review all sorts of horrible things, who did not engage in combat. And so therefore they're not considered eligible for combat-based PTSD from the Army. There are places within the Army who do try to cover some of that, but it's really complicated within all of that.
Okay, well, go ahead.
What I want to say is that there are challenges in the system, but there's also a lot of goodwill. I was most recently at a convening that ICAR did, focusing on reservists and mental health needs, and it had representatives from the Army who relate to both those who are in full service, those who are in reserve service, which are like frustratingly separate, especially nowadays, and other organizations, and there's such a desire to get it right. And I think that's a benefit from these sorts of conversations from funders and philanthropists, foundations, federations, whoever they might be, in making these connections and having these conversations, is that we're forcing them to talk with one another and lean on their better angels of getting it right. So I feel optimistic about the ability of the organizations to close the gaps more and more, and serve and find ways to help those who it's not clear what their path is.
All right, so we have one last question, but we're running out of time. So I'm gonna ask this question and also ask you to make sort of your closing thoughts at the same time, if I can, because it's a great general question, which was, how does the mental health crisis show up in everyday life and impact the way Israeli society functions, from the workplace to schools to communal life? So maybe, I know that's a big question, and Brina just gasped.
I think just the three of us could answer that question on a personal level, not in professional level.
Right.
And that's daunting.
It is daunting. So if you can, as you're giving us your final charge and your thoughts, incorporate that to the best of your ability. Jonathan, you want to go first?
Sure. So for sure, the last 2 years has taken a toll on virtually everybody in Israel on multiple levels. Like Rena said, I can talk personally, I can talk professionally. And I think if I wanted to summarize it, it's this tension that on the one hand, everybody's tired. We're really, I think there's a major problem, a burnout on multiple levels that exist. And yet at the same time, as has been noted, and I think it's really important, we're also resilient. And so we're tired, but we're not going to give up. And we're going to figure out how to really get more energy and get back to ourselves and even grow from where we are now. And I think that it's really important that, I think from an Israeli perspective, the support that Israel gets from abroad, and I know it's very complicated right now, but is really both meaningful and really influential. And just little things like Israelis knowing, on the one hand, being afraid to say whether or not they're Israeli when they're outside of Israel, and at the same time knowing there are bases throughout the world where they can be themselves and where they're going to get support is really also essential. And I think also, just for all of the federations, I think it's really important to know that every little bit helps for every NGO that exists. And so, like, don't be afraid that, oh, you only have a little to do, because every little bit is also another sign of support that people are getting throughout the country. And thank you all for that support.
Thanks. Gila.
Sure. So, I would say on how we feel it day to day, maybe I'll take more personal examples to bring it to life. But, I have a 12-year-old who told me, do you think it's hard for sensitive people that war? Obviously, when a kid asks you that, you say, why? Like, do you think you're sensitive? He said, no, I'm talking about other people, but because I have a technique. It's like, what's your technique? It's like, I call it the frozen heart. Whenever there's too much in the news and I'm hearing too many things, I freeze my heart so that it doesn't feel. And then when I feel like I can, then I thaw it and then I can feel it. And basically this kid has learned disassociation, consciously, right? He does it consciously. Then there's an impact on physical health. My daughter, on New Year's Eve of 2024, I was at a wedding. There's a big azaka, red alert. It was, the sirens, and it was the first time I wasn't home for it. So they ran into by themselves. And then in the morning, I see she has dots in her back, and I wasn't sure what it was. And it was shingles. The stress of that experience, gave her shingles at 5 years old. And so that's the impact on physical health that we're seeing everywhere, right? I'm using my personal example, but we're seeing cardiovascular, autoimmune diseases, et cetera. And then there's the impact on the productivity and the security of the nation, where anecdotally, we know that 30% of high schoolers don't go to school in the north and in the south. And kids are 2.5 times more likely to repeat a grade after a traumatic event. And people are also more likely not to go back to work. And that's a big issue for the productivity of Israel. And on the security side, car accidents are up 20%. Think about all these people that are hyperactivated or distracted when they're driving. Deadly car accidents are up 20%. But also domestic abuse and violence, when people are hyperactivated, that is also much more common. So those are the things that we're seeing day to day that we're not always thinking about. And, in terms of what I wanted to end with, I would say, our resilience is really real. I think we all tried to show that. But resilience alone is not a national strategy. And we really need a national strategy where we have systems that enable that resilience, systems that learn, that adapt, that grow, and that include everyone so we don't have more inequities in the system. And I think that if we build those systems together, then it's not only that we build a better Israel, it's that we build a better mental health system for the rest of the world, because everybody needs a better mental health system.
That's a very inspiring note. Rena.
I really resonated, Gila, with your stories, and I'll say that the public shelter in our apartment building, because we don't have a secure room on our floor, we haven't put away the chairs and the and the water and the extra equipment that we brought down. It's still sitting there. It's still, and in part because our children didn't want us to. But I'm going to tell someone else's story that I got to experience. In the spring, myself, Graham Campbell, and Naomi Fine from our team in Israel were visiting kibbutz near Yitzhak, which is in on the Gaza border. I mentioned that, I didn't say the date, in February 2024, the Federation's Emergency Fund granted community-directed grants to 90 different locations in the north and the south to communities that had been evacuated. And, excuse me, we define these as community resilience grants. And we really gave a lot of flexibility to the community to utilize it for the ways that they needed. We wanted to give them agency. We wanted to give them the discretion to do what they needed to meet the resilient needs of their community. In Nir Yitzhak, there was an art therapist, and she, when they had gotten evacuated to Eilat, right away saw a need to set up a station in a room off the lobby of the hotel, to meet the needs of the community, to be a space where the community could come together, the kids especially, to do art therapy. And so they wanted the support for when they ultimately returned to develop out this art therapy resilience center on their kibbutz. So we went to go visit it and saw this beautiful space and spaces that were being expanded, filled with people. We were there in the morning, and in the morning, older members of the community would come and they would have support in developing different projects. And in the afternoon, we were told that younger children, and then older children, and then the teens, and then at night, the adults are all using this space. And we were finishing up, and it was beautiful. I mean, it was just amazing. And we were finishing up, and an older gentleman came over. He was kind of intrigued as to who we were and what we were doing there. And so we explained who we were. And he identified himself. He said, "My name is Giora Rudayev, and my son Lior is a hostage still in Gaza." This was back in the spring. And he talked about how important this space was for him, that he came here every day, and it was a place for him to be, to hold. And I realized then, of course, just how critical these sorts of communal resilience initiatives were, both on the communal level and then for Giora. I think we're all so happy to say that Lior has been returned to his family. And I thought right away of meeting Giora back then when I saw the news, and I hope that the space continues to provide this amazing kibbutz, all of its members, a place to come to and rebuild.
So I have tears in my eyes, probably many of you do too. Every time I engage with one of these professionals, and I engage with them on Zoom, and the first thing I always try to ask Rena is, how are you? And I think as a system, we have to be so unbelievably grateful to our colleagues from JFNA, to our colleagues from all the nonprofits who are every day trying to take care of their own families and themselves in the midst of this ever-changing crisis, and yet who are taking care of Israelis in such powerful and beautiful ways. So I hope you will join me in giving a sincere gratitude and round of applause to our panelists. And we couldn't address every question, but we're all here, and so come talk to us if there's something on your mind. Thank you so much.